when you look towards the future, where all of this is headed, we are going to get to a place where health is pretty much like automated by artificial intelligence. You can choose to look at it one of two ways. This is going to be the end of everything, or this is going to propel humanity into sort of the next evolution.
You're talking about this purpose-driven AI platform that democratizes health and health information. This has to be, if done right, very threatening to a system that are historically gatekeepers.
The irony is it's threatening to us as well, because if we're effective at our job, we will have worked ourselves out of a job.
A lot of America, even if they're not practicing Christians, would have some skepticism around this.
For sure. I love bringing in the theology with the AI conversation because it's so...
Nate, welcome to the pod, my friend.
Yeah, thanks for having me out.
You flew out. Have you ever been to Pennsylvania before?
No.
Hey,
first time.
First time. And you went to New York for the first time, which is wild to me. All the success and travel you've done, you've never been to New York. How was New York?
It was spectacular. I mean, it was insane. There's nothing that I've experienced like it where you can just, as far as you can see, skyscrapers.
Yeah.
And how fast the city moves. I went with my wife and my co-founder and his wife, and I could definitely spend some time out there.
Yeah. Yeah, I love visiting it. I go as often as I can. I'd never want to live there. I think a lot of people say that. It's a cliched American thing to say, but it is something very unparalleled for its, it is for, you can appreciate it for what it is.
I've never been drawn to the city life. But, I've been traveling more often and seeing more cities, and it's, there is some sort of appeal. Sure, never lived there, but I don't know, maybe I have a place there. Yeah. That doesn't sound too bad.
Yeah, no, hey, it's that's the life, right? Okay, so go back to, I'm such a fan of what you're doing with Gevity. That's why I wanted you on the pod. And we got to know each other a few months now. And I met you through Alex Clark. And I saw you on her show. I loved what you were doing, and she connected us. And you guys know each other, right? I mean, you're both in Phoenix, Scottsdale area.
Same church, yep.
Yeah, same church. That's amazing. Okay, so how did you get to this place? I mean, take us back to sort of the impetus of you getting into the health space.
Yeah, so certainly never expected myself to be in the health space per se. I've always been a software guy. So when I was young, I started building computers and hacking video games and like all of this sort of what you would probably consider like nerdier stuff. I found very exciting. And I really never stopped that. So throughout high school, I was building these auto checkout softwares where there were like these limited edition sneakers that would release, every so often. And they would sell out instantly. Everybody wanted these, and they had resale value. So in high school, I built this software where as soon as an item would release, instantaneously I would check it out. So I would send thousands of requests to the website and try to check out multiple of these products. And that sort of like got me started with my entrepreneurial journey. I started building these bots and reselling sneakers in high school. And I was a really good basketball player. So I was the player of the year my senior year of high school in Arizona. I was heavily recruited. I was supposed to go and play in college. I was actually going to go to Yale. It was between a handful of Ivy Leagues. Yale's sort of where I, narrowed my focus. And the summer before college, I started this venture. And I built this online educational platform using, of course, software to bring in entrepreneurs, sort of experts in various niches, drop shipping, day trading, reselling, all of these things. And we would bring in these aspiring entrepreneurs to come and learn from these people. And it was a subscription-based model. It did really well. It did really well on accident. I started this thing with no real ambition to build this, multi-million-dollar company. I was young. I just wanted to make enough to afford rent, to get out of my parents' house the summer before college and, have a little bit of money to spend. That's my money. Well, just by happenstance, this thing grew sort of to a pretty big place. We had thousands of active subscribers across the world. And I ended up getting an offer to get acquired just a couple years into the company. Because I started that company, because it was doing so well, I opted to not go to college. I told my parents. I remember sitting them down and letting them know I'm just, I don't think I'm going to go play basketball in college. And when you tell your parents that you're not going to pursue an Ivy League, goodness, now I have two boys. If they ever told me that right now, I mean, of course they're way too young. I can imagine how I would feel. But they eventually came around and supported the idea and ended up selling that company a couple years later.
Okay.
And that was really cool. It was a great experience. I learned a lot in that experience. Around that time, we found out my father was diagnosed with cancer. And so he was diagnosed with non-small cell lung cancer. My father, he did everything right. I mean, it made no sense to any of us. He was a non-smoker. He worked out 4 or 5 days a week. He trained hard. He didn't have this incredibly stressful lifestyle. He wasn't an entrepreneur or a founder or an attorney or a doctor. He was, he was in business, but he wasn't under this immense stress. He did pretty well. He was outside. He was active. He ate generally clean. He didn't drink hardly ever. So it was a real shock. He was 58 years old, 57 when we found out. And goodness, just that whole process is ultimately what led me here. From the jump, when he first went to the doctor, he went to the doctor with this lower back pain, which since, coming out and explaining my story to people, I find is incredibly common. It's like, yeah, I know so-and-so who passed away or had cancer and they found out that they had cancer through lower back pain. So he went to the doctor and the doctor was very dismissive, which is just, again, not uncommon. I'm going through all of this myself and experiencing, the inadequacies of the system. Well, his back pain gets worse and worse and worse until ultimately he can't really walk. So that's when they take him serious enough to go in and do more testing. And when they go and do the screening, they find tumors everywhere. What was causing that back pain was a tumor that was pushing against his spine and breaking his back, literally. So he was dealing with a broken back for months before they took him serious enough to go in and look. And unfortunately, by that time, it was just like, it was too late. There was a chance, but not much of one. And this was during the height of COVID. So of course they're forcing the vaccine on everybody and on my father and anybody who wants to come visit my father. Now we fought that really hard and they ended up letting us visit him, but they still had rules. It was one visitor per room at a time. It's like we couldn't be a family unit while my father was there at the hospital. And there were just so many issues that we were experiencing with the traditional healthcare system, particularly the hospital system. It was so frustrating. Also, the insurance companies dealing with that. I mean, just everything about this was all but easy. And when you're dealing with cancer, you shouldn't have to deal with the stresses of all of these other things. Insurance companies coming in and making your life even more difficult. The hospitals making it difficult for you to be there with your family. So, man, I still have such a terrible taste in my mouth about that whole experience, obviously. He ended up passing away September 8th, 2021. He was 58 years old when he passed. And that was just a few months after I got married to my wife. It was a few months before we found out we were pregnant with our first boy. And that's kind of when I knew I had to get into this space. So because my background was technology, I was exploring various technologies that were emerging that at the time weren't very good, like large language models, which now have gotten really good. I saw the writing on the wall. I saw where things were trending. I saw the implications of technology such as large language models in various industries, but at that time, because of my experience with my father and having just gone through all of that, I saw how they could be used in health. And obviously, growing up an athlete, I always took care of myself. And beyond that, I was quite experimental, experimenting with various compounds, peptides, etc. So I had an interest in this from a consumer perspective. Around that time, there were multiple sort of diagnostic options in the marketplace, but not too many. We had these very expensive finger prick test kits, of course, the venous blood draws via phlebotomy. And that was really that. But there weren't really any convenient, very extensive solutions. And I knew that is where things needed to start. Technology is, great, but on its own, it's not sufficient. You need to pair it with a lot of really high quality data. And I figured, well, what if we took blood work and other metrics from your wearable devices, your health history, all of this stuff, and synthesized it using artificial intelligence? Was that possible? It started with blood work, so that's where the journey began. We built this blood work panel by assembling a team of people way smarter than myself, experts in various medical niches, from people who have emphasis in functional medicine and longevity to urologists to OBs, etc., and brought them together to build our panel for us. And we've since refined the panel. We're always refining the panel, but comprehensive, extensive blood work is absolutely necessary. It's a necessary starting point. And then what we did is we built this technology that is capable, better than humanly possible, of making sense of all of it. It's very difficult to find people who are able to make sense of 100 different biomarkers across various health systems and cross-reference that with your medical history, bring in your wearable metrics. If you've done a genetic test, bringing in that information, or a GI map, bringing in that information. What supplements are you taking? What medications are you currently taking? Did you take in the past? It's possible, but we're talking a lot of hours spent on one patient, and human error is still a component. We're humans. We're flawed. We will make mistakes. We will not evolve past making mistakes. And artificial intelligence makes mistakes as well. You have to be mindful of that. We've, installed measures to mitigate that as much as possible. But when you look towards the future, where all of this is headed is many people can't wrap their heads around this. We are going to get to a place where health is pretty much like automated by artificial intelligence. And diagnostics, are you familiar with Moore's Law? Moore's Law, simply put, it was first applied to chips, like microchips. Okay. Basically, the footprint of these chips will continuously get smaller and smaller and smaller, but more powerful. And this has been true and will remain true as far as we know or are concerned. And this doesn't apply to just like processing chips in our computers. This applies to all sorts of technologies, including lab technology. So we're talking about a future where your health is automated by a wearable device that sort of has replaced blood work, where it's lab-on-chip technology. This technology exists. Right now today, there's several companies that are selling these lab-on-chip devices, but they're really looking at like one or two markers. Yeah. Have you seen those devices where maybe it'll be a finger prick or something where it's looking at cortisol? It's like one-off markers, or sometimes it's you pee on a stick and it'll give you some sort of data. Well, it's a similar technology to that, but we're talking, instead of looking at one or two markers, eventually, in my bull cases, within the next 10 years, we will have the technology to actually have sort of this continuous glucose monitor-like device that's looking at far more than just your blood glucose. We're talking your hormones, CBC, lipids, all of it. Now, we're not there today, but that is where I believe the future is headed. I think it's a near certainty. Yeah. But you have to start with software, and that's what we're working on at Gevity.
It's amazing.
Yeah.
Fascinating, man. Okay, so I'm sorry to backtrack a little bit, but I don't know, and I'm wondering if for the average, maybe I'm the only one that doesn't know this stuff. But large language models, what is that exactly? Is that the same as AI or different than AI?
So AI is sort of this like categorization, artificial intelligence, right? So AI has existed for so long, but now modern day AI and large language models have become synonymous. Okay. So when people are talking about AI, in most instances, they're talking about large language models. Now, large language models are not that old. They haven't been around that long. They've gotten really good over the past couple years. And have you played around with ChatGPT?
Yeah, a little bit. Okay. And Grok.
Yeah. Okay. Yeah. Grok is amazing.
Yeah.
So these large language models, they don't think and reason like us. A great way to explain it is, let's say you read all the books in existence, all the comics in existence, all the academic studies and journals.
Studies, yeah.
But you don't memorize it. You just memorize the patterns, sort of like your autofill on your iPhone, right? Whenever you're typing, it'll show you what the next word probably will be.
Yeah.
It's recognizing patterns, pattern recognition. It's not actually remembering all of this stuff and thinking and creating this new sort of unoriginal thought. What it's doing is it's finding patterns in what you're talking about and using this pattern recognition to ultimately form sentences, paragraphs, etc. And that's really cool. So it doesn't work like our minds work. It's not capable of thinking on its own. It's not capable of coming up with anything original.
Yeah.
It can't, because it only knows what it has been trained on. Artificial general intelligence, which is AGI, which is where all of this is headed, the precursor is large language models. That is where we sort of evolve past the pattern recognition. And this technology gets to a place where it's able to come up with original thoughts. Now, we're not there today, as far as I know. Who knows? Maybe Google DeepMind has cracked that and we don't know about it. But that is going to change everything. I'm talking, if you take the thought experiment to its end, we will reach this sort of, it's not a technocratic society. It's more of we'll go from like a democracy to what's called an algocracy. So an algocracy is essentially the authority of our world will be this artificial general intelligence, which is kind of crazy.
Sounds dystopian.
Dystopian or utopian, probably dystopian because of human nature.
Yeah, right. The road to hell was paved with good intentions.
Yeah, it's sort of like you can look at it, the Icarus and his wax wings flying too close to the sun, right? Yes. And that's my base case. Now, a lot of good can come of this technology. However, in this technology, there's no stopping it. It's coming, and it's coming within our lifetime. It's coming sooner than we know it.
Right.
But there are massive implications. In the more near term, we're talking job displacement. So I have a couple buddies. I have somebody I know, he has a company called Figure, and we've connected over the years through X. Figure builds humanoid robots. They just released a couple of videos of humanoid robots doing laundry or putting the dishes away. So, and they're powered by large language models. People don't understand that the whole job market, the whole workforce is about to shift. And that scares some people. I don't think it should. I think that ultimately it'll be better. But as it relates to health and wellness, what it will allow is a data-driven, objective sort of solution to stay on top of your health, to, I believe, make you default healthy. I don't think we talk so much about proactive care, and we live in a society where that is the lens and how we have to approach life and health. We have to be proactive about it, because if we're not, we're going to get sick. We're going to get fat. We're going to, develop chronic diseases and all of this stuff.
Yeah.
However, it shouldn't be that way. And I don't think it will have to be that way because of these technologies. I think we will actually be able to be default healthy for the first time ever, at least, since we ate from the tree. And that's really, really exciting. And it's not as far off as I think people want to believe it is.
Yeah. Well, let's talk about where AI is now and what you have with Gevity and utilizing this when it comes to health. And then I want to talk about just AI as a whole and the sort of these more of what we're talking about. I really want to get into the weeds on it. But okay, let's start with where we're at now with technology. It's ever evolving and growing at a rapid pace. What can we do now utilizing AI for our health?
Yeah. So where AI is at today, let's take Grok, right? So, I love talking about IQ testing. It's just fun to talk about. It's not the best metric to use to measure intelligence or intellect, but it is a decent one. Grok is sitting around, Grok 4 was sitting around 136. So qualifies for the Mensa club. You have to be a 132 to be a Mensa. And that's really awesome because the average doctor's IQ is believed to be, now of course, we're not asking every doctor to do an IQ test, around 125. So we know that this reasoning model is technically smarter, air quotes, than doctors in a lot of ways. Certainly more capable. However, it's computers. It's a software. There's no human component. There's no emotion. There's no. The thing about health is it's deeply personal, and AI doesn't have the ability to truthfully get personal with you.
Yes.
So yes, we'll see where the future heads. But yes, you're correct. So today, it is a very good tool to use alongside what you're already doing. It's a great way to become more efficient, right? So the way we use it at Gevity, I had mentioned our blood work that we're doing on everybody who signs up for Gevity looks at roughly 100 different biomarkers. And we ask them a very extensive amount of questions, a lot of questions when they sign up as well. We ask them to link their wearable devices to our platform as well, so we can pull in that information. And the first thing we do is we compile all of this. If you can visualize a funnel, all of this health information is going into the top of the funnel. And what comes out initially is sort of this AI/machine learning generated care plan. Now, that's not good enough on its own because it doesn't have the context of like who that person really is. It knows all the quantitative, data, but not much of the qualitative. And so what we do from there is blood work results come back. We put them into this really nice looking report. It's very long, and we show you, exactly where you're at, what the optimal range is, of course the reference range, but within that range, what's optimal for your age and whatnot. And we spend about 45 minutes going through your blood work with you. And the whole time we have an AI scribe listening. So a great use case for, any physician should be using artificial intelligence to replace, your scribe. It's tremendously useful. And so we have this AI scribe listening in and pulling out relevant context from the conversation and doing all the charting notes and keeping a full transcription of the conversation. Now that rough draft care plan I just mentioned, a few seconds ago, this context from the conversation now gets added to that sort of rough draft 2.0. And once the call is finished, then our care team goes in and reviews what AI has been able to create based off of everything. And we always make some sort of tweak. We don't ever just like, here's what AI generated.
Yeah, and that's that gospel, yeah.
There's still, it's really, really good. It still needs to be reviewed by humans. And it is not good enough to where we have ever had a case where we haven't made any changes to something. And so what our care plans look like is we start with the foundational stuff: lifestyle, nutrition, sleep, stress, fitness, all of those things. And then we get into supplementation. So supplementation based off of your body and your body's needs. And if you really like this supplement, we'll add that in.
Yeah.
And then from there, we get into the, and this is for whatever reason controversial, but some of the prescription stuff. Hormone therapy if you need it. So, if you come to us, you're menopausal or perimenopausal, you're a candidate. we can offer that, and that'll be part of your care plan. Or if you're, a 50-year-old male and your testosterone isn't what it used to be, let's get your testosterone back up. If you hate needles, let's find another way. But we love peptides. Now, peptides are, they're so misunderstood in my opinion. And I don't think that's anybody's fault. I think they're just relatively new to, the market.
The market, yeah.
So the care plan introduces, the lifestyle, supplements, and prescriptions. We review it, we send it out, and then our AI over time, we do blood work every 6 months, is constantly monitoring your, if you have a wearable, your wearables. We ask you to do, actually, we're adding this feature to the app, probably by the time this airs, daily journals, so we can know, how did you sleep last night? You slept poorly, why? Like what was different? If we are not able to recognize what was different ourselves, we'll ask you, did you drink? Did you eat any processed foods? Like, we want all of this. The more information, the better, because the more information we have, even if we're not able to utilize it today, we certainly will be able to utilize it eventually. That's why I'm a fan of whole genome sequencing. It's like, yeah, sure, we can't make sense of hardly any of it right now, but the rate in which technology is progressing, it's a certainty that we will be able to make sense of it.
Yeah.
And so, yeah, if you're like using, if you want a practical application for AI and what it's doing today, it's great for research. It's great for cleaning up your copywriting, or,
the scribe aspect.
And how I use it in a practical application is sometimes I'm a little bit of, I don't know, Eli, my co-founder who's sitting over there, he can attest. Sometimes I could be a little direct, and it's not always well received. I don't necessarily mean it that way. A great use case I use it for is, take this email and make it nice. And I end up just sending that.
Oh, that's hysterical.
So people think I'm the nicest guy in the world. But AI just knows what to do.
That's wild. So it's allowing doctors, physicians, health professionals to work smarter, not harder, and really kind of amplify help, right, through utilizing it. Okay, so you mentioned this sort of pattern recognition and where it's at right now, but then that sort of leap at some point in the near future is sort of this original thought, and that's going to be a real big shift in how we see things. And then we jump to sort of this society that's shifted to AI being this sort of overlord to some degree. So I'm assuming this is what's being postulated by people, is like the end result of what could be.
Yeah, I mean, I'm always looking at what can be and trying to reverse engineer.
Yeah.
I think it's just, it's hard. It's whatever can happen will happen. And is that Murphy's Law or something?
Yeah, right. And what can't go wrong will go wrong.
What can't go wrong will go wrong. Let's make that less negative. Whatever can happen will happen.
Okay, so then, all right, I've heard Elon Musk, who again is like one of these like leaders in this world, right? And I heard him say his initial reaction to AI was negative because he saw the potential wrong of what we're talking about, but he came to the point of sort of building Grok as, it's going to happen whether he's there or not. So why not be a force of good within some significant issues? Is that how you feel about Gevity?
Absolutely. Yeah, it's one. I mean, first of all, I'm a huge fan of Elon's. I'm a big supporter of most of what he does, if not all that he does. And he's done some wrong things, but his vision of the future is what I'm in support of. I don't necessarily believe his outspokenness against AI originally was due to his concern about its implications. Those concerns are valid, but he was behind in the race, and he pushed for more regulation, and was a sort of this negative voice towards AI until Grok caught up. And now, honestly, I think Grok is, in a lot of ways, the superior model. It's not. I use various models for different things. Other models are better at, math. Other models are better at copywriting. Some are better at research, etc. But yeah, I think that you need to be utilizing this technology if you want to do the best at whatever craft that might be. So you can buy back your time. You got into this space to be relational and to help people. You didn't get into this space to, well, I don't want to speak for you, but I'd imagine you didn't get into the space to be like bogged down with charting notes and like all of this other stuff.
Definitely not.
Right.
Definitely not.
So,
that is right.
Yep. So you buy back your time, work smarter, not harder. But you have to be implementing this. Otherwise, you will get replaced by somebody who is. And that's not the reason why we're doing it. The reason why we're doing it is because we recognize that the outcomes of this technology will be such where we will get to default healthy as Americans, and eventually the world. We're talking, how can we bring true health equity to everybody? Well, it's incredibly challenging right now. And artificial intelligence really can sort of democratize health or longevity, wellness. And so, the future can be, you can choose to look at it one of two ways. This is going to be the end of everything, or this is going to propel humanity into sort of the next evolution.
Yeah. Growing up the way that you and I grow up, I think we grew up pretty, had a lot of similarities as far as the culture. A lot of Christians, let's just go there, Christian dispensationalists, they would see like all this like prophecy coming to pass, this sort of concept of a chip in your body, and it makes a lot of people nervous because it's stuff that's like, okay, what sounded sort of far-fetched is now quite reality. So what's your take on that as a man of faith? Whether, and people have different views, so I don't want to pigeonhole anybody, but you know what I'm saying. A lot of America, even if they're not practicing Christians, would have some skepticism around this.
For sure. Absolutely valid. And a great point. I love bringing in the theology with the AI conversation because it's so intertwined. Well, to your point, like what's prophesied in the Bible, it's prophecy. It's going to happen. We can't suppress what will happen. What will happen is going to happen. And so, if there's this technology that, Revelation or wherever is talking about, this, you can't buy, sell, or trade without this, or whatever that might be. The wrong thing to do in my mind would be to suppress such technology, because it's the Bible, which I believe is, the Word of God, is telling us that this is going to happen. So you need to be mindful of that, of course. I don't think you just like want to willy-nilly sort of jump into this without considering its implications. However, I think that it's hard for me to view this as sort of the biblical prophecy of not being able to buy, sell, or trade. I think there's probably a stronger argument that Bitcoin or something like that would be such prophecy, which I'm also a big fan of Bitcoin. Yeah. However, when we're talking about things, are you familiar with Peter Thiel?
Yes.
Yep. So he's, I think in a couple weeks, he's doing a small little speaking engagement that will not be recorded, and it's talking about eschatology. It's talking about the end times, and
he's Catholic, right?
He's a professed Christian. Yeah. So now again, very unorthodox. I believe he went viral most recently for this interview that he did, and he was asked a question: does humanity have the right to exist, or should humanity exist? And Peter Thiel, his mind works very different. So he got ridiculed because he took way too long to answer that question. And the reason why I believe that was, just kind of understanding his worldview, is essentially you and I and everybody in this room, we're sort of, not to sound gross, but like meat bags. Like it's a vessel, right? I don't believe our bodies are who we are per se. And so Peter Thiel sees these sort of advancements in technology, large language models, artificial general intelligence, humanoid robots, all of this stuff that was once just a far-fetched futuristic dream that would never happen, which is now our reality. He views, more than likely, based off of what I'm able to gather, end times as it's not we die and our spirits go somewhere. Maybe end times are either we upload our consciousness into a server and we live in eternity, in a server somewhere, or we live in eternity in a humanoid robot form factor.
Yeah.
These crazy things.
Yeah.
And so, those are the conversations I love having, marrying technology with theology. Now, I believe more of the orthodox approach to what may happen. Mm-hmm. However, I try really hard not to dig my feet too far into the sand with anything, because I think as Christians, that is like it's something we do so often. We were just talking about, Calvinism, and
before we started recording, we got deep really quick.
Right. Yep. We just jumped right into it. And I had mentioned, I think I would subscribe to Calvinism if I had to sort of put a title on it, but I have trouble calling myself a Calvinist. I am willing to change my position on Calvinism or any theological topic if I'm met with evidence that supports whatever that might be better than what evidence I have that supports my current view. So I digress. The conversation between health, wellness, technology, and theology is like this sort of trifecta that I love living in. It's sort of how I operate.
Right. And I think it's important to note, and I'm quite aware of this, that any change throughout human history was met by this, right? It's like, this is a significant leap in humanity. So you're going to have people like me and other people that have like a predisposition towards this shift of change as being something negative, especially if you marry that with theology of like reading into things that aren't there. It's just change, and humanity has changed, and it's been good, and there's been bad about it too. But you kind of take the yin with the yang. That's kind of my take on it.
Absolutely, it will inevitably be used for, poor, for negative, for bad, evil. But we need to do everything we can to not only mitigate that, but offset any of that with real positive change. And we have the tools at our disposal. For the first time ever, we have the ability to actually use data to support a proactive, preventative lifestyle. I talk a lot about the traditional system, and oftentimes I'm overly, I'm too much of a critic. It's hard because up until, let's call it the last 10 years, we've had to have a totally reactive system. I mean, look back to when we first came to America. It's like we were dealing with yellow fever and rattlesnake bites. It's like, there's nothing you can do to prevent that. Honestly, at that time, we didn't have modern medicine. And now we have the ability to run extremely comprehensive blood work from the comfort of your home, like Gevity does. We have the technology to help your practitioner make sense of all of this so they can do their job better, basically enhance their ability to help people.
Yeah.
And we have real-time tracking systems like your Apple Watch or Oura Ring or Fitbit or Whoop or whatever, that we're pulling in this other data that is helpful to know. And we can change the paradigm. We can totally change our approach to care. It will become the new norm. If we're talking roughly 20% of our GDP is made up of healthcare, I am certain that most of that is, drug research, hospital systems, et cetera. I hope that Gevity and companies like Gevity will take that 20% and repurpose that. So we're talking the $2 billion that they just put into the Scottsdale, Arizona Mayo Clinic. It's not any longer $2 million on this presupposition that you're going to get sick. It's $2 billion being spent preventing you from getting sick in the first place. Better quality food, better quality air, easier access to diagnostics, like these sort of things. So I'm very optimistic about the future. And that is not my normal stance on life generally. I'm typically glass half empty, but it's very hard to be glass half empty when I see where all of this is headed.
What do you think of as we talking about now, AI now, the bias that people report? Like it seems bent towards a certain ideology or certain worldview, and you can sort of yeah, let's go start there. Like, is that an issue? And if so, how do we fix that?
It's a real issue. Absolutely. It's an incredible issue that's very complicated to fix. Now, I don't necessarily believe that companies like, well, maybe there is a small belief that companies like OpenAI do this, but I don't think that many other companies are creating the software in such a way where it is intentionally biased. The issue is what it's trained on. The internet as a whole is incredibly biased. It is flooded with misinformation and just flat out lies and propaganda and all of this stuff. And it's incredibly difficult to find the source of truth. Like, what is the source of truth? And there's debates on everything, and there always will be, on what's true and what's not true. So you're met with just absorbing all of it. And when you absorb the full internet and train your models on the internet, you are ultimately going to be, now, not to get political, but you're going to be met with a left-leaning model, inevitably, because there is so much more on the internet that is left-leaning than right-leaning. Mm-hmm. And we notice that in the models. So our models very much don't like Donald Trump. Our models definitely think that Elon Musk is, bad for society, except for Grok. But that makes sense.
Well, see, it's bent towards who's
it's so difficult,
it.
Right? It's so difficult. That's why we need to remove all of that. And that's another reason why I would not ever recommend you just taking your blood work and uploading it to ChatGPT, mm-hmm. because I talk about this a lot. AI bias is a very real thing. We're not ever coming to these LLMs and asking them a question that we already know the answer to, obviously, because we wouldn't ask them that. What we're doing is we're recognizing that this technology is the first time I've ever been able to communicate with something that's not human, yet get a response back in my natural language that's incredibly convincing. And so people end up taking it as gospel. Mm-hmm. They're like, well, this technology is marvelous, so I have to assume that it's right. It's not. It's often wrong. We use it a ton, but we have a policy. You need to verify the output every single time. In most instances, if it's a complex question, it's going to get something wrong, even if it's minuscule. But when we're talking about health, when we're talking about analyzing blood work, mm-hmm. being wrong there is problematic. It can be potentially very harmful. And so we need purpose-built AIs. These general large language models like ChatGPT and Grok, they're really good for consumers. They're really good as like a co-pilot or an assistant, a researcher, help you with math, those sort of things, but they're not purpose-built for health. That's where companies like Gevity and others come in. Can we train these models off of what we believe? And this is the hard thing. Like, how do we have to be the ones to decide what is a good study and what's a bad study. And that's mm-hmm. a very challenging place to be, because it is so easy to implement your bias. Mm-hmm. How can we be objective through all of that? But let's sort of cut through that. Let's just go to your real health information and see what's happening and track trends over time and do our best to, train our models on good studies. We know that 70% of the studies out there, the clinical phase 3 clinical trials, are funded by pharmaceutical companies and biotech companies. That's a huge conflict of interest. You're telling me that what our doctors are trained on in med school is funded by 70% of it's funded by big pharmaceutical companies or biotech companies, and there's not an issue there? Goodness, if you believe there's not an issue there, then ignorance is maybe it's bliss, maybe it's not. But
the level of cognitive dissonance,
right? It's incredibly annoying and frustrating that more people don't talk about this. I have family in med school. I have family who are doctors, and they're going through this right now, and they're just being indoctrinated into this ideology that's very against what we're talking about here and what we're doing. It's like we have been grouped into this woo-woo, oh, those people, they talk to plants and hug trees, and they believe the sun will heal everything. It's like, no, that's not what we're talking about here. Don't overgeneralize. There's real science and data that supports what we're talking about here. The issue is big pharmaceutical companies aren't spending hundreds of millions of dollars on anything that they can't monetize. They're not, if they can't patent it, they're not putting it through a phase 3 clinical trial.
And if you get, like, you're talking about this purpose-driven AI platform that democratizes health and health information and agency for people's health and allows doctors to work smarter, not harder, this has to be, if done right, very threatening to a system that are historically gatekeepers and the opposite of what we're talking about, right?
It's threatening to them. The irony is it's threatening to us as well, because if we're effective at our job, we will have worked ourselves out of a job. If we can make America default healthy and provide sort of this automated, lab on chip technology with a software base that becomes this doctor in your, pocket sort of thing, well, then companies like Gevity cease to exist. But the prerequisite or the precursor to that would be, we have to open source this. We have to decentralize it, if you will. I'm a big fan of decentralization and open sourcing. But the real cool thing is,
what does that look like? What would that look like? The decentralization and the open sourcing of what Gevity looks like, or health AI?
It's what I call a living meta-analysis. And we have the ability to do that at Gevity and other companies in telehealth who perform advanced diagnostics have the ability to do it as well, assuming they can build the software to do it. A living meta-analysis. We can look at our complete patient base. And because we're looking at so much data, we can run our own internal studies based off of that. Let's anonymize it. Let's de-identify it. Of course, let's get consent, because we don't want to just open source somebody else's information that we don't actually own. You own your health information. No company should ever own your health information. And let's open it up so other people can reference it. That way, now we're not just relying on these pharmaceutical funded studies as the source of truth that our whole system is built on. We can look to companies like Gevity and others, and people can question, well, are they doctoring the information? They have financial incentive to say that this supplement works better than it actually does. We can actually decentralize it, very similar to, I don't know, I'd be shocked, but pleasantly shocked if your audience has as much of a knowledge on Bitcoin. Maybe they do, maybe they don't, but Bitcoin's this very niche thing. Maybe it's not as niche anymore. What's really cool about that is I can go onto the blockchain, which is what this cryptocurrency runs on, and I can go and look at every transaction that's taken place. I don't have to just trust that the transfer of value is moving from point A to point B. I can go in and verify and make sure that it is. And so that same idea, I don't have to trust that what Big Pharma is telling me through their studies is right. I can go in and verify by looking at the data, by looking at the blood work. This person has been taking this peptide. Their blood work started here, it went to here. We talk a lot about biological age and the various biological age clocks. Their Grim age went from here to here. Their percentage of optimal biomarkers went from here to here. And so that is incredibly important.
Yeah, powerfully so. So overall, you think you have a positive outlook on where things are headed. You would say so.
Yeah.
Got it. So I have to pick your brain about peptides before we run out of time. So I know you're into peptides. Like, what are your favorite peptides right now as far as the data is concerned?
Man, so hard data or anecdata?
But let's do hard data first, and then what's promising as far as anecdotal.
Yeah, I'd say, I mean, because there's such a broad spectrum of peptides for growth hormone releasing hormone peptides or growth hormone secretagogues, we know they work. The only one that's FDA approved is Samorelin, which funnily enough is like the least effective growth hormone releasing hormone peptide. We know it works, and we know it works internally because people who take Samorelin, we notice their IGF-1 increases in their next blood work, which is indicative of it working. And so, however, then there's peptides that the FDA does not approve of for, we can speculate on those reasons. I believe it's suppression because they can't monetize it. CJC ipamorelin or CJC 1295 ipamorelin, a highly effective peptide for releasing growth hormone. I think if we're talking about aging better, if we're talking about increasing health span and ultimately increasing lifespan, having a growth hormone secretagogue peptide in your stack is incredible. It's not like taking exogenous growth hormone where you're going to get those problems. Your body's not going to produce more than it needs to produce. It's just going to produce it more effectively. And so I love that. BPC 157 is talked about widely. Now, there's not a ton of research on, funded research on these things, which is unfortunate. And it'll always be that way until companies like Gevity start publishing our own research, because again, nobody is altruistic enough to spend $100 million studying these
on something that isn't massively profitable to the industry.
Yep. So BPC 157 used to sort of be this gym bro underground healing peptide where bodybuilders would take it whenever they got injured and they wanted to heal quicker. What we see now is it has amazing implications on systemic inflammation, gut inflammation specifically. So you can take it orally, you can take it subcutaneously, and I swear by BPC 157. There is research on it, and it's available. But with these peptides, the challenge is sourcing them, because research chemical companies are the legal loophole, the way to legally sell them. But research chemicals are not for human consumption. They're not regulated. The facilities that they're compounding these things in are not FDA registered facilities. They don't have to be. They are meant to be used for research in vitro, not research on yourself, but obviously in a lab, in a test tube. And so you need to get them from a pharmacy. That's critical. Now, another peptide that is so amazing is GHK-Cu. Yeah. It is. We've seen it for many years in beauty products.
Copper peptide.
Yep, copper peptide. And in topical creams, I take it. I actually just ordered from the pharmacy the subcutaneous injection form, but I've been taking it sublingual troche for, a few months. I've taken it on and off. Now, my lifestyle is such where today I have to pretty much rely on biohacking, air quotes. I kind of hate that term, but
me too.
To stay healthy. Otherwise, just my lifestyle, I'm so busy, and it's not a great excuse. I think those three peptides are amazing peptides.
Yeah, I agree. All of those we use those clinically, and they're significant needle movers for people, for sure. So I want to go back real fast. Is that sort of, you mentioned, if we're doing this within AI and what you're doing with Gevity, you're going to be working yourself out of a job, and the sort of concept of this different type of society in the future, sometime maybe sooner rather than later. I've heard the argument be from people that are really looking at these, where the end result could be, is that's why they're arguing for a universal wage, that's livable wage, because people are not going to have jobs. And we saw this maybe less extreme historically when the automobile came out, right? And people that were in the wagon business were screwed. So do you see it as bigger than that, sort of a leap within mankind?
I'd say proportionally, it'd be very similar to what you just explained right there, which is an example that I use often, automobiles. Yeah. So many people thought this was the end of so much livelihoods would be lost, but that's not actually what ends up happening. The workforce doesn't get smaller. It continues to be, and it continues to grow. Now, a universal basic income, I've always been against. But again, you have to be capable and willing to open your mind up beyond what exists today. We live in a supposed democracy, and we know sort of the way the systems today work across the world. But it's very challenging to allow your mind to go to a place that doesn't already exist. Where today in a democracy, in a capitalist society, the idea of a universal basic income would be troublesome. It'd be bothersome. I don't like it. But if we're talking about a completely new thing, this algocracy, it may be sort of this necessary solution.
A necessary thing within that system.
Right.
Yeah, I could see that. What do you think of people, even today, we're talking about AI now. This is not future AI hypothesis. This is now. People that, I forget where I read the report, but it was people using not these purpose-driven AIs. They were using, I think, ChatGPT and for mental health care. And they had suicidal ideations. They were mentally unwell. And they died by suicide because they were not getting the proper care. But people are really leaning on these sort of non-purpose driven these AIs. What's your thought on that?
Yeah, well,
it's happening.
I know, and healthcare is personal. So we know companies who, you can call them competitors, who are so hyperfixated on replacing doctors. But there is a very big difference fundamentally between us and them. It's our ideology. It's we don't want to replace doctors because we recognize that humans are hardwired for human connection. We need to talk to somebody. We need to talk to a subject matter expert. It's not enough to just start venting to a computer system. It just doesn't work. There's something that maybe we can't measure today, but there is something I think that we can all agree on to talking to a human, right? Versus talking to AI or Google or a wall. It's just like we have souls. That is important. And I'm all for artificial intelligence as a tool to make you better at your craft and ultimately automate a lot of the sort of the quantifiable data. But again, there needs to be somebody there, at least today, to deliver that information. Mental health is a whole other thing because that more than optimizing your physiology, it requires talking to somebody.
Yeah.
My base case is you're not going to see the results that you want to see talking to a large language model about your mental health struggles compared to talking to a human, a subject matter expert human about your mental health struggles.
That is utilizing AI for themselves
exactly.
as the healthcare professional. I love that, the distinction there of where we're at right now. I was talking to a friend of mine, Ginny Urich, 1,000 Hours Outside. You know who she is? You guys could get connected for sure.
Yeah.
She's in Michigan. She's telling me the story. She has a friend that is a AI researcher, right? And part of his research was that he was going to, this is a married man, and through his research was going to date AI. I don't know the purpose of their study. I have holes in my story, but the point of it is that he was dating his AI for research purposes only. At least that was what he told his wife. Is that he'd take her out to dinner. He'd go places. She apparently had clothes on. Okay, she had a certain dress on, and part of the study was he had to tell her an opinion about what she was wearing, and he felt bad, like he was going to hurt her feelings. And then we hear these reports of people dating AI, right? And this is a researcher that then get to this point of this AI of not wanting to hurt her feelings because she had a dress on and he didn't like or whatever. Wild. And he knew he wasn't the people spending hours online not for research purposes. So I guess this is a long-winded way of asking, like, what do you think of people dating AI? Good or bad?
I'd say bad. I think it's absolutely crazy. And I'm super curious about that, though. It's like, man, I really want to understand more why that is happening. How are you able to have an attraction or develop a relationship with a non-living entity? It's in my mind, it's nonsensical. but there has to be something that can be measured and studied there as to why that is.
Well, it's so much. It's the anonymity of, right? It's like the low. It's frictionless, right? To show up and just because it requires that human connection. It's easier to just go to a non-living thing.
We've seen movies about this, by the way. Goodness, what's her name? I forget the actress's name. She was the actress in the old Transformers movie. She's so famous.
Megan Fox.
Megan Fox.
Yeah.
She was a robot in this movie, and ends up the husband. I don't know what happened to the wife. I was hardly watching this movie, but I know enough. Again, there's holes in this one too. This husband somehow develops an attraction towards this robot. There's multiple movies out there like this.
These writers knew, they're prescient. I mean, I go to Wall-E as well, like prophetic. Pixar prophecy. And then I would go to one other, it's newly on Netflix, but I watched it when it was on CBS. It's called Extant. People watch it on Netflix. Steven Spielberg, I think, is the creator behind it.
He's amazing.
He just has such a brain. It talks about this futuristic, quote unquote, this was made 15 years or 13 years ago or something like that. So keep in mind when it was made, it was over a decade ago. And it talks about this war, this rise of AI with these sort of alien type beings that they call cherubim. I mean, it's wild, the stories of this. But AI ends up consuming humanity. I'll just cut to the chase. So sorry, spoiler alert. But AI is a problem.
Yeah.
Or not AI, but you know what I mean, technology.
What movie is there that we know of where the world ends positively because of AI?
Yeah.
I don't know of any. I know Terminator, it doesn't end well. It's it's hopefully that's not prophetic or foreshadowing what the future looks like, but you kind of bring up an interesting point. If you want to come up with this revolutionary idea or do something very new or futuristic, go read old sci-fi. Now, I'm not kidding when I say this. I do not believe any idea is really all that original. And if there is such thing as originality, it is from the artistic creative minds, the writers, the painters, the artists. The concept of a self-driving car was first introduced, I believe it was 1920 or something like that. I'll have to find the date. Don't fact check me on that, or find out what the date is. It was a while ago. It was before we had computer systems that were able to even do anything at all. We're talking a computer system that took up the size of this whole wall behind you. And we didn't have like any sort of existing technology where we can look to the future and say, one day there are going to be cars that drive themselves. Before any of the underlying technology really existed for this idea to have really any merit, it was being written about. Now we fast forward 100 years and we have self-driving cars. The same thing with the wearables. Like that was an old sci-fi thing. Have you seen the movie Baymax? Now I have young children.
Oh yes, and I do not have any young kids anymore, but I would watch it again. Actually, I recently did with my kids who are teenagers and not too cool for it.
It's a great movie.
Love it. Yeah, another Disney masterpiece.
I love thinking about Baymax as we're building Gevity. So
that's cool.
It's hard to say that there's such thing as an original thought. If you're super fixated, which I would probably advise not to be, because if you choose sort of the wanting to change the world founder life, you're met with a lot of challenges. Relationally, of course, with work, like it's not as glamorous as it may seem outside looking in. But if you feel called to that path, start reading old sci-fi. You'll get some good ideas.
Great advice. And let me be clear. Like we talk about a lot of dystopian things. I overall think AI can be used for good or bad. And what you're doing with Gevity is exactly how I feel like it can serve humanity the best, right? It's enhancing our life. It's purpose driven. It is used to support humanity, not replace us.
If you can't, you have to understand, you can't stop it. It's coming. You cannot stop a freight train from taking its course by just saying, I don't want it to happen. It's going to happen.
It's not going to work, guys.
You have to,
as much as I may have tried.
Right. You have to get with it. And if you've got to get with it in a positive way. And also, the last thing I'll say, I don't know how much time we have, but I want to talk about this one thing. We look for the past 100 years at our average life expectancy. And that chart up until about 2010 looked very, very good, very healthy. We were trending positive. And then it plateaued, and then COVID, it went down a little bit. Now, to reach escape velocity, to change the trajectory again, so it's going back up. Now, I'm not somebody who believes, unless I'm met with evidence that can convince me that we'll live into our 200s, but I think we'll be able to live healthily well into our hundreds.
Yeah, 120.
But like yeah, 120, I think that's totally feasible. Now, to reach that escape velocity, we need artificial intelligence. Otherwise, I don't think we can get there.
Yeah. That's well said, well-rounded. Before you go, the podcast is called The Art of Being Well. At the end, we have Your Art of Being Well. What's the most disgusting, healthy food that you eat for health purposes, not for taste?
Disgusting health food
just,
that I eat for...
you can maybe appreciate it, because disgusting is relative, but you're not doing for the taste.
Yeah, that's a good question. I tried for a while doing the beef liver when that was popular.
Is it not popular anymore?
It may still
past?
be.
Is it jump the shark?
Who knows?
Organ meat, jump the shark.
I tried doing it, and my iron skyrocketed. So,
okay. Do you have an HFE single, like double, like is a hemochromatosis gene?
I don't know, honestly. I need to. I have.
Some people can have and they don't know. They don't have hemochromatosis, but they have a gene that sort of slows down the clearance of iron. Or you just may have had too much freaking iron because of the amount of. Talk about heme iron in its most richest form.
I'm gonna look right after because I'm
sure it's in testing. Your data somewhere.
Yeah,
I'm sure it's in the cloud.
Yeah, it's in the cloud. That's for sure.
Ask the cloud. Ask her.
So my wife cooks for me. She puts everything on my plate that I consume. And she's a tremendous cook. So, it's something disgusting that I eat. I'm not picky. I mean, I think maybe some people find this gross. Sometimes I do, but usually not, like canned sardines.
That's a good answer.
Yeah.
It's a good answer. Do you take supplements? And if so, what are two lesser known, maybe little unique supplements that people should know about? Yes,
I do take supplements. I'm biased, and I'm going to shout out Gevity here, but I do our supplements, which who produces our supplements is Zymogen, and we know Zymogen. And it's just what my body suggests I need, so that changes over the course of time. Things, the NAD precursors are now popular. Mm-hmm. I like them. I like the science behind them. I know that there's mixed opinion. I'd say...
Do you have a favorite precursor between...
NR versus NMN?
Yeah.
Yeah, I think NR. I just think it's more... They're both researched. It makes more sense to me. I believe... I might be mistaken here, but I believe NMN has to convert to NR before it can actually convert to NAD.
That's what the NR advocates definitely, in my mind, that they take the lead on... the sort of the logic behind it, but I've seen success with both.
Yeah, and I've taken both.
Yeah.
So a low-key supplement, it's hard. There's if you count peptides, but I'm sure you don't. Maybe you do.
We can, yeah.
Peptides, yeah. GHKCU.
Yeah.
I'm probably a little too critical about collagen supplements, but I'm like, well, why not just tell your brain to make more collagen?
Yeah, and that's where the copper peptide comes from.
Yep. So that, and I think curcumin is a great supplement as well.
Yeah, great. What's the weirdest or most out of the box thing you've done for your wellness that you're willing to admit on a podcast?
Weirdest, most out of the box thing that I've done for my wellness. So we have a family cabin up in northern Arizona. And
I love that you didn't flinch either. He knew what he was going to say.
Yeah, because I have pictures of this. We might not want to post them. So it snows up there. And, I was very much like researching with myself in how I respond to cold plunging. And because it snows up there, I strip down to just my underwear, and I'm talking underwear and snow boots, and just went and laid in the snow and did snow angels for wellness purposes.
Yeah. Hey,
so it was meditative.
I love it, man.
Yep.
I mean, that is the ancestral cold plunging.
There
you
we
don't
go.
need some expensive bathtub with freezing water.
No.
Just go to the mountains.
Yep.
What part, where in the mountains in Arizona?
Pine Top.
My father-in-law has a house in Pine Top.
Really?
Yes.
It's not a huge town.
It is a small town in the mountains in Arizona.
We love it up there.
I love Pine Top.
It's amazing. I golf, so there's good golf up there.
Yeah.
My father-in-law, he's a member at White Mountain Country Club. I don't know if you know.
No.
But
Pine Top, Sholo. What are the other?
Sholo.
Yeah.
It's pretty much just those two, and Pine Top, Lakeside, Sholo, and it's really those two in that area.
Yeah, that's awesome. Yeah, well, hey,
small world.
I know. I did not do snow angels yet in Pine Top. I need to get to that.
For wellness purposes.
Yeah, for wellness purposes, you have to add that. Okay, what's a book that you've read? It could be fiction or nonfiction that just I should add to the Art of Being Well book club for people. It's like a must read.
If it's not in there, The Alchemist.
Nice.
Yeah.
Yeah, amazing. It's been years since I read it. I need to reread that.
It's one that I try to read annually.
Yeah. Paulo. Right?
And it's just like the truth in, I believe it's God, the God of the Bible, but some, cultures can call it the universe, conspiring towards you in your...
working for you.
Yeah, working for you.
Yeah.
And achieving what your personal legend is, who you are supposed to be and what you are supposed to achieve.
Amazing.
And the journey of getting there, it's not all uphill, and you will be met with challenges, and you will be met with decisions, but staying sort of outside of your comfort zone to do what you're called towards.
Great place to end. Nate, where do people go to learn more about your work and Gevity?
Yeah, you can find me personally, Nate Graville. That's my last name is a tougher one to spell, Graville, Nate Graville on Instagram or LinkedIn. And then Gevity, I don't know if you can see it on this hat right here, but gogevity.com, Gogeviti, or GoGevity on Instagram. You can find us there. We try to, be educational on our Instagram. Just those two places.
Nate, thanks for coming on.
Thanks for having me.
Thanks, man.